Good afternoon and welcome to this live webinar. I'm Andrew Naparotic and this is the third webinar in the Impact series, brought to you by Practice Advisors 360. This series will cover COVID-19 related topics which are impacting the businesses of healthcare practitioners today. These webinars will be short, insightful and purposeful, and will provide meaningful information relative to today's COVID-19 economic environment. This particular webinar will focus on positioning your practice for restart, with a particular focus on what you need to know about insurance at restart. It will run for 10 minutes, with an opportunity for 5 minutes of questions and answers at the end of the presentation. I'm excited to be joined by Nick Partridge. Nick is the founder and president of 5 Lakes Dental Practice Solutions, a consulting and technology firm helping dental practices develop, implement, and manage PPO participation strategies to attract and retain patients. For more than 10 years, Nick has been an industry thought leader in understanding and analyzing the impact of dental insurance networks and how this relates to the financial health of a dental practice. Nick, welcome to the webinar. Let's start with your view on how COVID-19 will impact practices when they reopen.
Yeah, well, first of all, thank you for having me. I appreciate it. It's great to be here, and I appreciate the opportunity to weigh in. Obviously, the industry has been significantly impacted here, and so we're excited about getting back into the office safely and seeing patients again and rekindling those relationships. I think if you look at what's happened with COVID-19, the first thing that you have to say is don't overreact. There's a lot going on right now. This virus came very fast, and it came with unprecedented impact. And so as we put the pieces back together, we have to maintain our composure. And it's important that we don't overreact. There's a quote that I love from a consultant for investment advisors, and it says, "Wealth is not determined by investment performance, but by investor behavior." And so I think of us as your revenue advisor, right? Because you've got accountants who are out there managing your expenses with you. You've got folks managing various aspects of your practice, and we're really looking after the revenue of a practice, how you grow your patient base, what kind of fees you get reimbursed at. And so I really like that. Let's manage our behavior here, and let's make sure that we don't overreact. Because the question is when and how are patients going to return, and we don't know the answers to that yet. So I have some thoughts on that I'll opine on as we proceed through this, but we're trying to figure out when states are going to open, what they're going to allow, what the PPE guidelines are going to be, how involved is the ADA and the CDC in influencing change in the practices. So we don't know about what that means for patients. We don't know what that means for our practices. What does that mean for the schedule? How are we going to schedule patients? Are we going to start with patients that were in treatment? Are we going to start with patients that haven't been in a longer period of time? What does that mean for older folks, right, who are more at risk as a result of the virus? How long do we need to make accommodations for in our schedule to plan for limited contact in the waiting room, for appropriate cleaning between appointments? So there's a lot of questions. There's a lot of questions around when my patients get here. Are they going to have the same benefits that they did from when I saw them last? And are they going to have any benefits at all? And have they been impacted? Their family's been impacted by this, financially or otherwise. So there's things that we can do. There's solutions out there to address each one of these. But I think in a measured way, with time and an independent perspective, you need to kind of evaluate each of these scenarios before you restart to figure out what this means. So the question that we're getting a lot is, what will carriers do, or what are they doing right now in the wake of these times, right? So the first is, again, they have a measured response, right? So their response has been fairly muted, which I think is maybe frustrating to the provider community, but I think they're evaluating the circumstances. The conversations that we've been a part of are ones that are interested in finding mutually beneficial solutions. So the insurance companies are not sitting back saying, "Oh my gosh, this is a great opportunity to go pounce on the dental community." they're looking at this and saying, hey, how do we participate in as part of the solution, and what does that look like? And so you're going to get a lot of differing responses from the insurance companies. So some are doing nothing, some are doing some things, some are doing many things, right? And so this will continue to evolve as we advance through this return here, and we get everybody back to work. For example, Delta of Connecticut and New Jersey are not only offering financial assistance programs in the form of grants and claims advances, but they're also offering a PPE reimbursement. Principal and United Concordia joined forces in that effort last week by offering a PPE reimbursement as well. They differ. They each differ in terms of the dollar amounts, in terms of when the programs start, how long the programs are going to run for. And I think that's because we're all looking to figure out how this is going to play out. And so the ADA provided some guidance recommending that providers use the code D199, 1999. And so there's folks that are going to be filing those on their claim forms. I think the challenge with that is that this is a miscellaneous code. And so it's not really a great answer to the question. And so while a lot of folks are starting to file this on their claim form, they're coming back denied in many cases as an inclusive procedure, right? So in a lot of the PPO contracts, there are comments and requirements about what's inclusive, right? So you can't charge for, polish when you go do a cleaning because it's part of the cleaning, right? And so they say the cost that you bear for the polish has to be built into your cost for the pro fee. So same thing here with PPE, because you're not going to provide dental care without PPE, especially in a post-COVID world. So right now, if you're using this 1999 code, they're being denied because they're considered inclusive. Now, some of the programs are coming out saying, okay, well, if you use that code because that's what the ADA said, and we're trying to be consistent, we'll offer this reimbursement for you. So there's all kinds of varying answers, and you can't be discriminatory in your billing, right? So if you're going to charge somebody who's 75 because you want to be extra careful and use extra PPE or whatever, you have to charge somebody who's 25 the same amount, and you can't charge somebody who has insurance differently than somebody that does have insurance, right? And so there's, I think, a lot of opportunities to, as you're thinking about what to do, to maybe try to be doing the exact right thing, and you may put yourself in a position of liability by not charging everybody the same across the board. So we're waiting to see what the carriers will do, right? So in many cases, the insurance companies are still open, right? So all the insurance companies are still open. They're open and operating, and so we've been busy, advancing our efforts for our clients with applications and with negotiations and other EOB payments and things like that, getting things reprocessed. So the carriers are doing very well right now, if you think about it, because a lot of premiums are coming in and not a lot of claims dollars are going out. So they're in a very healthy financial position, and so they're looking to play the right role here in terms of helping the providers. So more will probably come out here from the carriers, over the next couple of months. This is another question that we get pretty commonly here, and that is, what should you do as a practice owner? And I think for us, there's a number of things that we want to focus on. The first is, how to deal with the PPE costs. And so we feel like the best way to handle this on a long-term basis is to review your UCR fees, your office fees. So we want to make sure that your office fees are in alignment with not only what's happening in your market, but they represent these new costs that you have to bear. So we would recommend the first thing that you can do, and the easiest thing to do, is probably review your office fees. Make sure that you're also not charging too much, because a lot of people are out of work. I think the numbers most recently here are 20 million out of work, which is about 15% of the labor force. So we also don't want to have our rates at the 80th or 90th percentile. We want to put ourselves in a position to be able to provide or offer affordable care for people. Always, it's develop and implement a PPO participation strategy. I think, never never before has there been such an importance for getting into the right networks for your market. So aligning yourself with the market, with your competitors, with the insurance companies that are prevalent in your area, and getting a strategy for how to participate. So which networks to participate in, how to do it with all their leased networks and partnerships and third-party relationships, maximizing your reimbursements, and doing it in a coordinated way. We work with so many offices that that have joined plans over time for various reasons. You know, an office manager put them in the program, this plan 5 years ago. They don't remember why she left. Then now they're just in it. They were in these networks and things changed. Now, you know, if you look at like a company like Emeritus, they now have multiple partners, 5, 6, 7 partners. So there's different ways to contract with Emeritus. And so, you know, maybe the way that you're in network is not the best way. Doctors are not contracted always consistently. So you could have 2 doctors that are in the same office. One's in network, one's out of network, just because paperwork got stuck somewhere and nobody was following up on it. You know, fee schedules aren't updated in the practice management system. So always, always, always. And I think more so than ever before, there's a focus and an importance on developing and implementing the proper strategy to participate in alignment with your market. And then you got to negotiate and maximize your reimbursements, right? So as you're going to bear these new PPE costs, which we estimate to be around 6 to 10% of production, are you going to absorb all those costs? That doesn't seem like the appropriate response, right? So you've got to be more aggressive, negotiating and maximizing your reimbursements where you can to help offset some of these new costs. And then lastly, continue to focus on patient communication. I think dentists that weren't very communicative in this process missed a big opportunity. And I think as people are coming back, it's going to be really, really important to continually communicate what you're doing as a practice, what you're experiencing, how things are going. Because, you know, if I'm sitting back and I'm thinking to myself, I'm a 75-year-old and I know that I have pre-existing conditions. And so the morbidity rate for COVID-19 is much more significant. You know, what's it going to take for me to go into the dental office? And I need to know that the dental office is taking all these precautions, and they've got not only the proper PPE, but they've done extensive cleaning. They have protocols in place to limit exposure. You know, am I going to wait in the car? Am I going to wait in the waiting room? Are you going to book appointments up? I've heard some conversations from people saying there's going to be a lot of no-shows, so jam your schedule. And that would terrify me, right? If I know that the schedule is overbooked to accommodate for no-shows and I'm in a at-risk situation trying to come in and complete treatment that was started in February. So you've got to focus on patient communication. So if you have the right insurance strategy, which means that you're making yourself accessible to your community, you have the right fees, you have an office membership plan in place, and you're communicating to your patients, you're gonna attract patients, because there are going to be some offices that don't make it through this. There are offices that are mortified by what's going on. They're without a plan, and they're not going to be able to respond to this. And so this is an opportunity, if you're looking at it the right way, I think, to grow your practice and to take to take patients from other places that maybe aren't opening back up or weren't responsible in their communication to their patients, or are, for a variety of reasons. So I just think it's a big opportunity if you're looking at it the right way.
Thanks, Nick. Some insightful information there. We've received some questions while you were speaking, and let me see how many we can get through here. The first question is from Josh in San Diego. Josh asks, what is the best approach regarding billing for PPE, and do we expect that to change moving forward?
That's a great question. So I've been very active monitoring various groups around the country, whether they be on LinkedIn, Facebook, Dental Town, talking to our own clients, looking on the web, and just getting there's a ton of questions similarly to this. So it's a great question. You're not alone. I think that there's a couple things that are going to happen. So number one is the ADA put out the guidance to use the code D1999. And I think it was premature. I know that they're well-intended. They've been doing a great job in many aspects of this recovery in terms of guiding providers. I think this was a little premature because they did not run it past any of the insurance companies. And the problem is that the insurance companies' systems are set up to auto-adjudicate claims, right? So if a cleaning comes in and it meets the criteria of frequencies and limitations, then they just auto-adjudicate it, right? They say, okay, pay it. A 1999 code or 999 code in general is kicked out and must be manually reviewed. So the insurance companies are not going to be supportive of paying a claim, paying PPE off of a manual review. It doesn't work well in their systems, I guess is what I'm saying. So I think what they're advocating for, and I hope the ADA will get on board here and swallow their pride a little bit and say, yes, we need to come up with a new code, and the new code will be specific for PPE, and that code will then also allow the insurance companies to set up their systems to auto-adjudicate and pay the PPE on a per patient per visit. So I think we're working in that direction long-term. I think short-term is, depending on the companies, the 5 companies so far that have released guidance for how to get reimbursed for PPE, you should follow those guidelines. You should otherwise bill with your fees, right? So we want you to build the PPE. In the absence of a specific code for PPE, we want you to build the PPE costs into your fees. So that requires a wholesale review of your office fees and making adjustments to codes to accommodate the PPE requirements. And then we'll see. So step 1 is do what it takes to get the money from the companies that have offered it. Step 2 is review your fees and build the PPE costs into your fees. And then step 3 later on would be to watch for a new code to be created, which would alleviate this kind of confusion.
Great, perfect. Thanks for that. I'm just conscious of time. We have time for one more question here, Nick. So if I move straight on to Jodi's question from Nashua in New Hampshire. She asks, how much impact will COVID-19 have on my practice today, and how long will it take to recover to normal levels?
Yeah, another great question. So I've read 2 studies. So Milliman is a consulting firm. They came out with a forecast based on where they thought utilization would be as a result of COVID, through COVID and then into the recovery. And their numbers were somewhere between 59 to 69% of a reduction in utilization. So that's a huge drop off. Similarly, the ADA with the Health Policy Institute forecasted a 66.5% reduction in dental spend. And so they said that they thought that the market would return to 80% of pre-COVID numbers by the second quarter of 2021. So you're talking a year from now. So those are pretty dire numbers on both parties. The good thing is that the ADA Health Policy Institute is also doing a survey of dentists, and I think the survey numbers were around somewhere between 12 and 18,000 providers were participating. And they're doing a study every 2 weeks to find out how things are recovering. And the first survey back after offices opened, there's 28 states as of today that are open. The numbers are very encouraging, right? So 33% have hired their staff back fully and are paying them fully. So I think we have the PPP loan to thank for that. And I think we also have the pent-up demand that we were expecting is also materializing, because if you look at this, they're saying that the patient volume is about 28% of normal. So when you think that only half of the states are roughly open, and in those states, only half of the providers are actually open and seeing patients in a full-time capacity. A lot of them are not still open yet because they're bringing their staffs back on. They're trying to secure the PPE. They want to make cleaning arrangements in their practice. They're communicating, scheduling, all that stuff. So a very small number of practices are actually open. It's like 1/4, and 28% of they're experiencing 28% of the volume, nationally here. So I think if I understand, I think the Health Policy Institute acknowledges that we're off to a good start. It's still early, like I was saying early on. Don't overreact. This might be a glut from treatment that was in process or emergencies that were held off a little bit, but good signs to start. So I'm optimistic. I think in past economic downturns, dentistry has held strong. I mean, obviously in a recession, everybody goes down, but dentistry tends to do a little bit better. So my advice is wait and see. Again, don't do anything crazy in the meantime. But I feel like the forecast was really bad, and the first couple of weeks coming out of the gate here look pretty good. So I hope for more of that. I hope we continue to see, patients returning to the chair.
Great, thank you for that, Nick. Unfortunately, that's all we have time for regarding questions and answers. However, we'll make all the questions and answers available on the Practice Advisors 360 website. If you haven't done so already, please register for upcoming webinars on the link on this page. This will help ensure that we keep you informed of the upcoming schedule. In addition, you can subscribe to the Practice Advisors 360 YouTube channel. A recording of this particular webinar will be placed there together with the other webinars recorded as part of this series. In the meantime, if you have any questions or require advice, please don't hesitate to reach Nick or Practice Advisors 360 and their dedicated team on the email and phone numbers provided here. Thank you for your time today, and please stay tuned for information about our 4th Impact webinar. Thank you.